Good day everyone. It is nice to see you again. Welcome to our Any Learning, as our learning community. Lesson 1. Principles of Emergency Nursing. Principles of Emergency Care. Emergency care can be defined as the episodic and crisis-oriented care provided to patients with conditions ranging from minor to serious or life-threatening injuries or illnesses. The philosophy of emergency care includes the concept that an emergency is whatever the patient or family considers it to be. Emergency nursing is a unique practice that deals with unstable, undiagnosed patients usually presenting unexpectedly. By definition, emergency care is care that must be rendered without delay. In a hospital emergency department, several patients with diverse health problems, some life-threatening, some not, may present to the emergency department simultaneously. One of the first principles of emergency care is triage. Emergency triage. The word triage comes from the French word trier, meaning to sort. In the daily routine of the emergency department, triage is used to sort patients into groups based on the severity of their health problems and the immediacy with which these problems must be treated. Emergency triage is a subspecialty of emergency nursing, which requires specific comprehensive educational preparation. Patients entering an emergency department are greeted by a triage nurse, who will perform a rapid evaluation of the patient to determine a level of acuity or priority of care. The triage nurse will assess the patient's chief complaint, general appearance, ABCD, airway, breathing, circulation, and disability, environment, limited history, and comorbidities. Thus, the primary role of the triage nurse is to make acuity and disposition decisions and set priorities, while maintaining awareness for potentially violent or communicable disease situations. Triage is an advanced skill. Emergency nurses spend many hours learning to classify different illnesses and injuries, to ensure that patients most in need of care do not wait to receive it. Protocols may be followed to initiate laboratory or X-ray studies from the triage area, while the patient waits for a bed in the emergency department. Collaborative protocols are developed and used by the triage nurse based on his or her level of experience. Also, nurses in the triage area collect crucial initial data like the following: vital signs and history, neurologic assessment findings, and diagnostic data if necessary. Priorities of care and triage categories. In the emergency department, we are using either of the two types of triage categories to prioritize care to patients. 1. 3-tiered triage system. 2. Standardized 5-level triage systems. 3-tiered triage system. We have the following. 1. Emergent. 2. Urgent. 3. Non-urgent. 1. Emergent. Patients have the highest priority. Their conditions are life-threatening, and they must be seen immediately. For example, we have the following. 2. Urgent. Patients have serious health problems, but not immediately life-threatening ones. They must be seen within 1 hour. Examples are the following. 3. Non-urgent. Patients have episodic illnesses that can be addressed within 24 hours without increased morbidity. Examples include the following. Standardized 5-level triage systems. It has been developed and proven through research to possess utility, validity, reliability, and safety. We have the following. Triage level 1. Immediately life-threatening or resuscitation. Triage level 2. Imminently life-threatening or emergent. Triage level 3. Potentially life-threatening / time critical or urgent. Triage level 4. Potentially life-serious / situational urgency or semi-urgent. And lastly, triage level 5. Less / non-urgent. Triage level 1. Immediately life-threatening or resuscitation. These are conditions requiring immediate clinician assessment. Any delay in treatment is potentially life or limb-threatening. It includes conditions such as the following. Triage Level 2. Imminently life-threatening or emergent. These are conditions requiring clinician assessment within 10 to 15 minutes of arrival. Examples are the following. Triage Level 3. Potentially life-threatening / time critical or urgent. These are conditions requiring clinician assessment within 30 minutes of arrival. Examples are the following. Triage Level 4. Potentially life-serious / situational urgency or semi-urgent. These are conditions requiring clinician assessment within 1 hour of arrival. Examples include Triage Level 5. Less / non-urgent. These are conditions requiring clinician assessment within 2 hours of arrival. It includes conditions such as the following. The following questions reflect the minimum information that should be obtained from the patient or from the person who accompanied the patient to the emergency department. Of course, all answers are documented for reference by other healthcare providers. And lastly, take note of this one. Routine emergency department triage protocols differ significantly from the triage protocols used in disasters and mass casualty incidents or field triage. Routine hospital triage directs all available resources to the patients who are most critically ill, regardless of the potential outcome. Thank you for listening. Have a good day and be safe. Agyamanag.